to day 3 of the North Carolina Serious Illness Coalition's virtual symposium, Joining Our Forces, Envisioning the Future of Serious Illness Care. Please be sure to check out our website for details on all of our sessions for the remainder of the week. I'll make sure to put a link in the chat for that. Moderating today's session are Karen Appert and Heather Burkhardt, co-chairs of the Caregiving and Patient Engagement Work Group of our coalition. With that, I'll pass things over to them.
Thanks, Virginia. And I see we still have people coming in, so I'll just get started. So we can do a little of the introduction information before we get started with the actual presentation. Sorry, my printer is printing now, and it's very loud, so I apologize in advance for the background noise. So as Virginia said, I'm Karen Appert, and I am co-chair of the Caregiver and Patient Engagement Work Group of the North Carolina Serious Illness Coalition, along with Heather Burkhardt. And I'm just going to give a little background on the Serious Illness Coalition for those who may not be familiar with it. We are a mostly volunteer organization formed in 2020 based on recommendations from the North Carolina Institute of Medicine Task Force on Serious Illness Care and its report, Improving Serious Illness Care in North Carolina. So in just 2 years, this coalition now has over 160 members representing more than 85 organizations, which I think is a pretty big accomplishment. We're very proud of it. Within the coalition, there are 4 work groups. There's clinical practice, advanced care planning, communications and advocacy, and caregiver and patient engagement. And if you'd like to learn more about the coalition, we'll put a link to the website in the chat. And as we mentioned, today's session is hosted by the Caregiver and Patient Engagement Work Group. Heather Burkhardt and I are co-leads. I will let Heather introduce herself, and then I'll introduce myself and tell a little bit more about our session this morning.
Good morning, everybody. I'm Heather Burkhardt. I am the Executive Director of the North Carolina Coalition on Aging, and we are proud members of the Serious Illness Coalition, and we're fortunate to be part of the task force 2 years ago and have had longstanding support and interest in family caregivers and see them as the backbone of our long-term care system and want to support them. And so a good portion of our work has always been focused on caregiving, and I think you're in for a treat today. So I'm glad folks have joined us this early in the morning.
Yes, I agree. Thank you very much for showing up early. We appreciate it. And for those who may not have been able to see the last 2 days, I know that they have been recorded. There were great sessions the last 2 days. So I highly recommend when those recordings are up on the Serious Illness Coalition website that you go back and check them out if you weren't able to see them live. So for those who don't know me, I'm Karen Appert, and I'm currently working with the North Carolina Division of Aging and Adult Services as a project coordinator on a senior hunger initiative. But I came to the aging field after having been a caregiver for a mother with MS and dementia for the last 25 years. So that's part of why I got involved in the North Carolina Serious Illness Coalition, and why I'm really excited about our presentation today. We do have a change in presenters, and we were kind of joking earlier that it seems sort of fitting for a family caregiving session that our original presenter, who is Mike Whitkey from the National Alliance for Caregiving, actually came down with strep the other day and is not able to present today. And so in true caregiving fashion, we have a great network of supporters, and we asked and are fortunate that Siena Ruggeri from Community Catalyst actually volunteered to step in. Siena's been involved in in a lot of the projects around the RAISE Act, from when it was an act to Congress all the way to the national strategy that was just released to Congress a couple months ago. So with that, I'm going to give a little background about Siena, and then I'm going to ask her to introduce herself, give us any more background that she would like to, and then she can get started with the presentation. We're just a little housekeeping. We're going to have her present And then afterwards, we're going to have a discussion, but we'd like this to be a conversation. So we're inviting you all to put any questions you might have for Siena in the chat, or just let us know that you do have a question that you're willing to come off chat after the presentation, and we'll have an open discussion about how the RAISE national strategy, the implications that it might have for states like ours. So Siena is a policy analyst for the Center for Consumer Engagement in Health Innovation at Community Catalyst. In her role, she works to ensure that public programs, including Medicare and Medicaid, better address the needs of consumers, particularly those with the most complex needs. Her work focuses on people duly enrolled in Medicare and Medicaid, family caregivers, and advancing opportunities to address social determinants of health and promote health equity. So we are so pleased that she was able to join us. And Siena, with that, I'll ask you to unmute and start your presentation. Thank you.
Thank you, Karen. Thank you, Heather. Pleasure to be here this morning. I'll say just a little bit more about me, and just know, as Karen and Heather know, I just like to talk. So don't feel like this needs to be a really formal presentation. I really do want to connect with you all and just have a discussion. So please don't be shy about asking questions. I will do my best to answer them, and hopefully we have a fruitful discussion. So in addition to my work at Community Catalyst, I have an interest in this work because my older sister has multiple disabilities, and both my parents are her family caregivers, and luckily they live in the state of Colorado where they're able to get paid to do that. Additionally, my grandfather recently passed in North Carolina, and my grandmother was his full-time caregiver for the last couple of years of his life. So in addition to caregiving, my family hails from East Carolina. So I jumped at the opportunity to work with Karen and Heather, and it's been a real pleasure to work with advocates in your state. So we can go ahead and go to the next slide. And I control the slides, so I don't know why I'm saying that. So just a quick agenda of what we're up to today. So I'm going to share some quick family caregiver facts, and then we're going to spend some time talking about federal legislation. And we're going to focus in on the RAISE Act, which I'll detail more in a bit, but if you have questions about other federal things, happy to answer those. We'll talk a bit about the family caregiver issues that were identified in the RAISE Act, and then we're going to talk about some of the efforts to organize caregivers and ensure caregivers from underrepresented communities, their voices are centered in this conversation. And then we will have ample time for Q&A. So please start thinking about questions. If you want to jot them down in the chat just so we have them for later, that's wonderful. And we'll go ahead and get started. Okay, so first of all, just some facts about family caregivers. 53 million people were providing some capacity of caregiving in 2019. And as we know, that number has probably gone up significantly on the COVID-19 pandemic. There's significant lost income for family caregiving. There's a lot of financial sacrifices that go into this work. And we at Community Catalyst are really excited to be doing this work now because we think there's been a real momentum to this movement. Folks understand very vividly the importance of caregiving, as you know, overnight folks had to scramble and put care together while working full time. So folks who maybe weren't aware of, you know, kind of the realities of caregiving, the pandemic really brought that to the forefront. There's a lot of interest at the federal level, at the state level, at the local level to start to address this caregiving crisis that's been simmering for decades, but is finally getting the recognition and problem solving it deserves. I'll just say quickly, I know we have caregivers in the room, but I think it's always important to highlight the stories of individual caregivers, knowing there's a lot of nuance to each caregiver story. So Karen will give you the link to this to look at later, but as part of the RAISE Act, they did this video series it's called Faces of RAISE, and I think it does a really good job of capturing a real diversity of caregivers. So if you want to learn about some of the caregivers profiled by the RAISE Act, this is a really great resource, and we always try and boost those stories as we talk about policy as well. All right, so now we're going to talk about federal legislation. So what exists currently? On the RAISE website, actually, there's a full inventory of what programming is available to family caregivers. I encourage you to take a look. But kind of two broad programs that are important to know about are the National Family Caregiver Support Program, as well as the Lifespan Respite Care Program. Both of these offer really important services to family caregivers, but they're insufficiently funded. So while they're doing great work, their outreach is extremely limited. And we also need to learn more about what works and what doesn't work in the implementation of these programs. There we go. So those are important to know about. We always, in addition, whenever we talk about caregiver issues, we advocate for, an increase in funding to these programs that already work so they can reach many more. So the RAISE Act, the full name is there, but we typically just call it the RAISE Act, has just been released in September. We'll talk more about kind of the process that got us there. But Karen will give you the link to take a look at the strategy as we're talking. But it comes in 4 pieces. So it's kind of a lot to peruse through. Definitely take some time to kind of click through and see what interests you. But this represents a pretty significant, a years-long effort and pretty watershed moment for building the momentum for family caregivers. This is what's unique about RAISE, is it provides a real roadmap for family caregiving, which really hasn't existed before. So the goal of this act is not to make a report and be done with it. The idea is to kind of catalyze actions at all levels, at the local level, at the state level, at the employer level, at the federal level, and really coordinate all of those actions into one broad roadmap that gives us a clear idea of where we're at and where we need to go. So I encourage you to look through those materials, and I'll talk more about kind of how we got to the RAISE Act. As Karen mentioned, I was involved in some of the process of developing the strategy to begin with and involved in implementing. So if you have questions about kind of how this came about, I'm happy to answer them. But I think another thing to point out is how involved family caregivers were in the development of this strategy and how rare that is, unfortunately. But there was just a tremendous amount of interest from family caregivers throughout this process. And uniquely, there was representation from both family caregivers and care recipients on the RAISE Council. So this work was really intentional in centering the voices of family caregivers themselves instead of, a lot of policymakers in DC talking about some folks like they're not in the room. So I'll go to my next slide and talk a little bit more about what this looks like. So I find RAISE helpful in doing caregiver advocacy work and just kind of organizing all the family caregiver issues we know are important into a few goals. I definitely use this framework in my work and just if someone asks me, what's it like to be a family caregiver? What are the issues they deal with? I use this. So I think it's a really helpful framework in that sense. And everything the RAISE Act did was really centered around these goals. So I'll give you a second to read through those. And I'm going to detail them more later on in the presentation, but just wanted to give you an idea of kind of how this strategy was organized. Okay. So what was the process of bringing race together? It's pretty tremendous, the efforts it took to get this across the finish line. So I think it's important to mention. So how did this come about? The Raise Family Caregivers Act was a law passed in 2018. It directed the Department of Health and Human Services, HHS, to develop a national strategy. Importantly, the critical piece was pulling together what we call the Raise Council. So the Raise Council was, I just see your question here, Tifa. Well, we can talk about that at the end. The Raise Council was really central to this work. So the Raise Council represents a diversity of stakeholders. Like I mentioned, there was family caregiver and care recipient representation on that council. There was also folks from all parts of federal and state government represented. So the Raise Council was tasked with surveying every issue that family caregivers across this country encounter, and summarizing that in one strategy and coming up with a roadmap. So you can imagine the task at hand for them was pretty big. And there was a lot of input from family caregivers at the beginning, a lot of data collection. And with that information, the Raise Council met regularly. They had one meeting before the pandemic, and then the rest happened virtually. And these are public meetings too, so you're welcome to attend these. I find them informative. Met regularly to really refine this huge swath of information into something actionable. A lot, in addition to kind of just the direct caregiver strategy that's on the ACL website that Karen shared, there's also the Raise Family Caregiver Resource and Dissemination Center. This is on NASHB's website. I can get the link up later. But NASHB convened the Raise faculty. So this was a group of experts who really provided guidance and structure for the Raise Council as they endeavored to build this roadmap. And there's a lot of great resources on there. There's a lot of state-specific resources on there, and a lot of good data that you can use in your own advocacy. So highly recommend that. So as you can see, there were some public meetings. There was the Raise Council met throughout, and there had to be a bit of an extension because the timeline for the initial Raise Act was pretty tight. So that gave them more time to really make sure we were doing the necessary outreach and just necessary discussion to make sure we had a product that was really representative of family caregivers and other stakeholders, and a roadmap that was usable. So I'll go on to my next slide. So as we linked before, there's the Raise National Strategy, and this is really the quote unquote finished product of the Raise Act. That was their congressional mandate, was to come up with this roadmap. So there's a few pieces to it. I would recommend starting with the overview document. Then you have some kind of key principles, which I'll talk a bit more about later. And then the federal actions themselves. So as you can see, nearly 350, it's a long one. And we'll talk about kind of where y'all can fit in that. But really the idea there is to just give the whole gamut of things that need to happen. The idea is if every stakeholder, if counties, if local government, if faith-based organizations, if employers, everyone takes a little piece of it, we can get to those 350 actions actually happening. So it's not a list of things everyone needs to do. It's a list of actions that we all need to collectively do to get to our goal of having a comprehensive web of support for family caregivers. So the idea will be to kind of look at that list and pluck out, okay, what would make the most sense for North Carolina advocates to be doing? What of this giant list of actions, federal and state actions, what makes most sense for us to take on? So yeah, you have a choice of more than 150. So importantly, we don't want the RAISE national strategy. It's a strategy and a roadmap. We don't want it to, it's not a congressional report that sits on a shelf and we reference it every once in a while. It's a living document. And it's also an unfunded mandate. So that means the implementation of this is really going to rest on stakeholders, especially community leaders, really taking this on. So now this is kind of a crucial point in the development of the RAISE Act, because we've fulfilled the congressional mandate. We came up with a strategy, but in order for it to be kind of a living document, and for it to really catalyze some momentum across states, it really depends on how well we engage. So doing things like this, really publicizing the RAISE Act, making sure folks know about it, making sure your average family caregiver has an idea of what that is and how it's going to help them in their day-to-day is critical, because us DC folks might have heard about it, but it really rests on making sure a really diverse group of folks who are involved in the lives of family caregivers understand it. So that looks like employers, that looks like health systems, that looks like legal services. It's a really broad spectrum of people that are really important to educate about the RAISE Act. And this is a unique opportunity that I really want to emphasize. And the National Alliance for Caregivers has template comments. So fear not, there is a template for this. There's currently a public comment period on the RAISE Act. So, we did a lot of outreach and engagement and public comments and public meetings about what the content of the strategy should be, but you always miss things on your first try. So this public comment is mainly asking folks to weigh in if the RAISE Act doesn't go far enough, or we miss something, or there's a really critical piece to this that we're not thinking about, that we haven't sketched out. So if you've done a public comment before, you might have done like a formal letter that you send as a PDF to the Federal Register. This is not that. The public it's a couple of question boxes, just with kind of some prompts that you fill in your response to. And there's, of course, some structure in the NAC template to do that if you would like it. But this is a really critical time, because before we really just pivot to implementation, we want to make sure that maybe folks who didn't know about the RAISE Act when it was being developed have a chance to have their voice heard. So really encourage commenting on that. And also, I think it's helpful in getting different stakeholders to think about what is my role in this. So I think this is a good exercise to start doing that, because really the success of the RAISE Act at this point depends on what we do with it. And that's going to require a truly widespread effort, and we need everyone's hands on deck to do that. So that's some more about RAISE. Feel free to start adding questions in there. We can have more of a discussion about the RAISE Act, how we put it together. Any questions about how we put it together, what's in the RAISE Act, what's not in the RAISE Act, how did this all come together? Happy to answer. And now I'm going to talk about some family caregiver issues, and I'm going to use the framework that was identified in the RAISE Act. Some of these are probably familiar to y'all, but figured I would just give an overview of kind of how we're thinking about family caregivers as a policy issue. So the first area is awareness and outreach. We know plenty of folks don't identify as caregivers, even though they are doing the tasks of caregiving. And as a result of, because they don't identify as caregivers, they're not seeking out services that have the word caregiver in them. So there's a lot of folks out there, we don't really have a sense of what that number is, who would probably benefit from a lot of the supports currently available, but just don't know about them. And also making sure caregiving is seen as a public health issue and not this kind of niche issue that only affects certain groups of people. It affects all of us, and really pushing to state, local, and federal leaders that caregiving is should be addressed as a public health issue. It's a crisis. It's a health crisis that's going to impact all of us. And additionally, a lot of caregiving supports, especially due to the limited funding, really don't reach people who speak different languages other than English, or different racial and ethnic groups who don't receive outreach that is appropriate that is culturally appropriate, that is culturally responsive. So there's a real need for developing communications to really reach populations that we've done a poor job of engaging with in the past. Because we know that family caregiving impacts different communities differently. And there's certain groups that are feeling a pronounced strain, but are not receiving sufficient outreach to, and are not receiving communications that resonate with them. So that's a real critical issue in just reaching caregivers. And then kind of under the broad topic of engagement, you could call this health systems engagement if you want. A lot of institutions don't see family caregivers as an entity. Like, there's really not the language for that in there. Or for example, there's not a really coding language in health systems for family caregivers. So a lot of this work is just speaking with systems that don't direct, HHS and the associate ACL know who family caregivers are, but that's one part of the federal government. What about all the other institutions that family caregivers interact with that aren't even looking at them as family caregivers? So a lot of this is reaching out to health systems and saying, you need to have a strategy for working with family caregivers. How are you identifying them? How are you supporting them? If you don't know who they are, how can you ensure they have some support? And this applies to schools too, especially for family caregivers of people under the age of 18, making sure they have that legal recognition as well. And there's a real need to integrate family caregivers into the care process, to be seen as part of the care team and not just this extra person on the sidelines, because of course we know caregivers have critical insights that make or break health outcomes for their care recipient. And then of course, access to services and supports. So education and training for family caregivers. We know, especially with medically complex cases, you have family caregivers who are thrust into the situation and don't really have the training on the particularities of the condition or disease they're caring for, and are forced to learn on the fly. And even family caregivers who have been caregiving for a while, obviously there's a lot of education that would be helpful just to make their job easier. Respite care is a really critical area. I know there's some folks in the room who work on that. We can talk more about that. And then trauma-informed services, culturally appropriate services. We know a lot of family caregivers, as well as those they care for, have had some significant trauma, especially with health systems, with legal systems. So making sure the services we do have available are trauma-informed, as well as culturally appropriate, like I mentioned before, making sure people of all backgrounds feel like their services are tailored to them, are responsive to their context. And of course, this looks like increasing funding for existing programs that are already doing this work, but need support to reach more people. And then in the workplace, the RAISE Act talks about paying family caregivers. So there's states like Colorado that are already doing this, supporting that development in other states. There's the idea of giving tax credit to caregivers, knowing the financial strain of caregiving, making sure working caregivers have paid leave and sick time, and kind of this idea of caregiver-friendly workplaces. So really reaching out to the private sector and large employers and saying, you know, if you want to be a family-friendly workplace, if you want to have healthy work-life balance, part of that also is being caregiver-friendly. So here's some criteria of what we mean by caregiver-friendly. And to call yourself a caregiver-friendly workplace, these are the kinds of things you need to have available to your employees. As well as just direct financial assistance. We know that one of the biggest challenges of family caregiving for a lot of folks is just the financial aspect. And then finally, want to talk a little bit about the work we're doing to organize caregivers and uplift family caregiver voices. The RAISE Act was a great first step in recognizing that family caregivers themselves know what they need, are the best experts in what they need. They don't need to be spoken about, but they need to be spoken with. So there's some other efforts underway that I think are really important to making sure family caregivers are centered in this process. First of all, reaching underengaged communities. So there's a lot of family caregivers that represent at least one diverse or underrepresented group. And by diverse and underrepresented, I mean things like LGBTQ plus people, racial and marginalized racial and ethnic groups, people of color, low income family caregivers. There's a lot of different intersections of identity that we know touch family caregiving that really change one's experience of being a caregiver. And a lot of that is not responded to. And we know the impacts of systemic racism mean that caregivers, particularly caregivers of color, are not receiving adequate supports, and those supports might just flat out not exist, or they might not be connected to supports in their community that they're eligible for. So there's a lot of work being done ensuring how do we respond to different identities of caregivers and how that affects their experience. I have a link in there. One part of the RAISE Act goes through that and there's really great insights from this group called the Diverse Elders Coalition that kind of gives us an idea of how we can be better responsive to this, because the success of this work really depends on that. All right. And then kind of a cross-cutting issue, as I mentioned, is many caregivers don't identify as such. So a lot of work is just finding the caregivers, even though they're in plain sight. And this is especially true for cultures where caregiving is completely different than others' interpretation of caregiving. For some folks, it just looks like I'm just fulfilling my familial obligation. This isn't anything special. This isn't a pronounced role. This is just what I do. So what the RAISE Council has found is most effective is just describe caregiving in terms of the tasks. Do you help your mom get to her appointments? Do you help your child who's medically complex? Do you provide treatments for them? Do you those kinds of things? So worrying less about the title and more describing it in terms of the tasks that one does, so we can kind of have a more widespread identification. Folks understand that they're part of this larger group that does these tasks. And then at Community Catalyst, we're doing something called the Changing the Care Conversation project, where we really equipping caregiver leaders to organize their own communities and other caregivers to advocate for policy solutions that improve support for family caregivers. This is how I got to work with Karen and Heather. We're in the middle of this process of organizing caregiver leaders. So that's one example of kind of how we're doing the kind of organizing part of it. So not just, providing actions, but also giving caregivers themselves the tools to advocate for themselves. And I'll go ahead and just jump into the discussion because I know we got a few questions. So I'm going to stop sharing my slides so we can be face to face. And Karen, if you want to give me my first question, I'm happy to get started.
Well, first of all, thank you, Siena. As usual, you are a wealth of knowledge and incredibly informed on everything that's gone into this this amazing national strategy. I mean, I think we keep coming back to the fact that even though it's a lot to take in and it's a huge pile of information and there's a lot to go through, it's still amazing that we are at a place in our country where caregivers have been recognized at the national level, and we're excited to see where this goes moving forward. So I'm going to jump in to some of the questions because there were some really valuable questions that I think can kind of tie in some of the things you were talking about, but also some that had come before today. You mentioned, I mean, you hit on so many things that our caregiver and patient engagement work group hits on. Caregiving across the lifespan, underrepresented communities, the fact that caregivers are not recognized in the as part of the healthcare team, which they should be. And as you know, unfortunately, North Carolina didn't pass the CARE Act, and we also didn't pass Medicaid expansion. So we're in a state that has a lot of challenges as it relates to supports that are coming at the state level. I want to mention one of our work group members, Parvati, who asked us a question. She is a parent of a child with complex needs, and she asked, how do we fund respite, support, and resources for medical parents who provide caregiving that is unique and highly specialized, in other words, not the norm of parenting? There's a huge lack of support services, funding, and consistent recognition for all caregivers who provide nursing level care to children. Suggestions?
Yeah, so on the respite front, that definitely came up in our development of the strategy, especially in our discussions of respite. The current respite system does not work for a lot of people for a lot of different reasons. And one of those is, one conception of respite is just having, it's a very narrow conception of respite. It's you take the person you care for to a location, or someone comes to you and you have a few hours to yourself. But we know that for both care recipients and caregivers, that just doesn't work, especially with, maybe there's some disease groups or conditions that works for, but others it's just destabilizing and it's not actually respite. Especially, I think this is especially true for medically complex people, where we kind of heard from caregivers in that situation of it's not really respite because I'm worried about their safety. I need someone who's really specialized. And I think that there's a lot in the actions proposed. I acknowledge it does not exist on the status quo, but the actions proposed provide kind of a roadmap of how to do that. First of all, if we're paying family caregivers, if we're viewing them as the skilled workers that they are, part of that is specialized education and training. And then as a result, we would also view respite providers as also a skilled workforce. So boosting training for family caregivers who probably need support on those things as well. And then there's a lot in there about making sure there's funding and support for training those respite providers themselves. So you can ideally we move to a world where if someone has medical complexity, there's respite providers who are specialized in that. And then I think also it's just reconceptualizing respite as not this very narrow understanding. And I think this is especially true for cultural competency. So for some people, respite looks like me and the person I care for go to the same place, but I meet with other caregivers and they connect with other people, a more community model, or like family members are more involved. So I think there's a lot of folks have rightfully challenged this really narrow interpretation of what respite is and how it doesn't work for most of us.
Yeah, and then that's the unfortunate part is, as you mentioned, when you're talking about complex and serious illness, you can't just hire a companion care person to come in and sit with your loved one. Heather,
I was going to go to the next question, if that's okay. And
yeah.
I think it's just been great, Siena. And I think having your vantage point at the national level is really helpful. When we talk about the RAISE report, because it is sort of a great opportunity nationally to put caregivers on, but then it gives states sort of this great menu to start having a conversation and prioritizing and thinking about where we are. But can you think about just sort of the goal for achieving this? What's the timeline? And then also when we talk about family caregivers, and you've said it a lot, the connotation of family means different things to different people, and it not always implies a real inclusiveness, especially when you're talking about LGBTQ communities and others. So what about the definition of family? If you could talk about the timeline and then just sort of the foundational word, family caregiver.
Sure. I'll start with the definition of family caregiver. The RAISE Council spent a lot of time having a robust discussion about how do we redefine this. So they actually have, I think it's like a note about terminology in the report. They describe kind of the process they undertook to do that. And they actually have a new definition of family caregiver that's different than what was articulated in the legislation. And that definition, I think, is a really good working definition to use because it is inclusive of non-biological family, different family structures, and really is broadly inclusive of all the different care situations we know exist. So I would really point folks towards the definition in the report. They do a really good job of explaining how they got there. And I'm definitely taking that and running so we can define family caregivers in a really inclusive way. In terms of the timeline, the main mandate of the federal legislation was to develop a roadmap. So there's actually not a discrete timeline. Everyone who's involved in family caregiving knows the ideal timeline is ASAP because this is a crisis, but there's actually not an official, we need to do it by this time. And it's not actually structured in terms of by this year we will do this. So really it's up to the community of advocates or family caregivers to really take things on and set your own timelines. You know, but in 5 years we will have implemented this state action. So in your situation, you know, maybe in 5 years, we want the state of North Carolina to do this action to support family caregivers. So unfortunately, I wish it were more structured, but as a result of it being an unfunded mandate, they couldn't really prescribe that. So just a roadmap. There's not like a discrete timeline.
I wanted to address one of the questions from Glenfield about the whether there was currently a repository of best caregiving practices. I put something in the chat on the Benjamin Rose Institute and Family Caregiver Alliance website, which is mostly focused on dementia caregiving. And I'm trying to remember in the report, do they have, I feel like they did a review somewhere of existing, well, I think it was the federal and state level existing programs, right?
Yeah. So there's like an inventory of what programs exist. And I would also, Glenn, I would also point you to the report itself. There's a whole section about research and data. So there's some specific recommendations, and we consulted a lot of folks who do that research. We talked to like academic institutions, research institutes, that kind of thing. about what exists and what needs to be done. So there's some good like prescriptions of what that looks like. In the status quo, I put that link in the chat to the RAISE Dissemination Center. That's really become a NASHB's, due to NASHB's role in the RAISE Act, that's really become the hub of information, and they're continuing to update that. So that's one I really default to for kind of best practices. And of course, there's other national folks in the field, Center for Healthcare Strategies, different national organizations that are doing work on caregiving and really publishing some of those best practices. I know CHCS just did one about like state actions to support family caregivers that have happened in a few states. So definitely a lot of places to look.
Thank you. One other, I wanted to, I'm sorry, I'm looking through the questions and sort of trying to do them in an order. Sue Deaton, one of our work group members, mentioned the question that we all wonder is, why do we not value or engage caregivers? They represent an incredible and essential element of care and public health. That's something that our group has been trying to really figure out more, how caregivers can get seen as not just valuable to the healthcare team, but as actually part of the healthcare team. And I think that's such a huge conversation that needs to continue to take place and actually be really forwarded as part of this whole thing, as part of the strategy.
And Karen, because I have a question on my mind that relates to that. So I'm going to throw it to you, Siena, while you take a look at the chat, if that's all right. But I appreciated your focus on the engagement of caregivers and valuing those with lived experience. And, you know, we're really excited to be part of your national grant, Changing the Care conversation. But particularly where we were talking about underrepresented communities of color and marginalized communities not being represented. Can you speak to the audience? Because we have, you know, people with a variety of expertise, and some at universities, some in healthcare systems, but how do you meaningfully, or how would you suggest to meaningfully engage caregivers at all levels? They're busy, they're stressed out, they're trying to keep everything moving in their plates, but you've said that we need to involve caregivers at every level. They need to be part of the caregiver. We want a part of, you know, looking at quality and reviewing programs. So what do you see as important ways to think about engaging them at all levels?
Yeah, I think what this issue area has really exposed is a lot of, you know, institutions, and I work in advocacy, and I count us as an institution in this regard, that we don't have built-in community engagement processes. So if that doesn't exist, you have to build it from scratch to reach family caregivers. So ideally, this can kind of be a lesson in, okay, well, let's already kind of have that process in place, because then when we have a question of, oh, how do we reach this community, we already know how to get a hold of them, and we already have a pre-existing relationship, because we know, you know, we don't want to do this like swooping into communities that we've underengaged with and suddenly declare ourselves the problem solvers. But a lot of that is going to be building trust. Especially I think with family caregivers, you know, who have had some really traumatic experiences with health systems and a lot of different systems. It's definitely not something that's going to happen overnight. So I think building those processes, not just for the purposes of this particular, like, we don't want to think of it in terms of how do we engage with family caregivers on this particular roadmap, more how do we build the systems where we're directly connected with communities and we can quickly get their perspective and their feedback. And in order to do that, you have to have the trust there. So we have a lot of, I can share more after this, we have a lot of resources just generally about community engagement, what works, what doesn't work, how do you really build yourself up to that? But I think a lot of it is just recognizing that due to the lack of those existing processes, we're building from the ground up, and it's not going to happen overnight, but that's not a reason not to do it. And then I think a lot, this sometimes gets lost in the shuffle, and this is sometimes things, it feels so obvious to us, but we have to emphasize it with policymakers a lot, is just just ask. Just ask people who are directly affected by the decision making how they feel about that. You would think that happens, but so often it doesn't. And then I think finally, making sure folks have the tools to engage. So I think we're doing some of that work of, we can't just tell a family caregiver to go head up to the state capitol, but we can give them some advocacy tools to feel empowered to do that for themselves. So I think making sure as you engage folks, you also give them education and training to support their capacity to participate in those conversations. So, if you want to talk to family caregivers about this really like heady policy thing, make sure maybe you just spend some time doing like a quick training about like, what do these terms mean? Like, this is the checklist that we're concerned with, like going through this checklist, just giving some tools so they feel like they're not just there, but they're actively influencing decision making.
I want to mention one that Teepa Snow, and we're excited that Teepa's on this call, rock star in family caregiving, especially for those living with dementia. She mentions, should we, those of us in North Carolina, start looking at training professional volunteers, since it seems as though funding is still pretty much off the table. And something that I laugh about sometimes is I think about, we have 53 million caregivers. We have a direct care workforce shortage. If you look at paying caregivers for the work they're doing, you could kind of even out it a little bit more. And I recognize that that's not the only issue, but it can solve so many problems. But as you know, there are limitations on who can be paid, at least as it relates to the Medicaid system. So what are your thoughts on training professional volunteers, which I really like that terminology?
Yeah, it's interesting you mentioned that, because that was one of the direct questions that we asked. We did listening sessions to kind of prepare the strategy itself. And we asked that, and we got some ideas, but I think that's something that definitely needs to be developed, because, you have things like the National Senior Corps, like there's models that exist. I think one suggestion I really liked was this idea of community ambassadors. This is especially true in faith communities, but this can really apply to any sort of community, because we talked with local service provider organizations, and their frustration was there are people in our zip code who don't know we exist. So a real role of volunteers can just be connecting, if they know there's family caregivers at their church, just saying, hey, did you know this thing existed and it's in your neighborhood? So this kind of a spin on community health workers, community ambassadors. I think that's a real role that volunteers can play. As far as like more broadly volunteers, I think that's something that the RAISE Council would probably appreciate some feedback on, because they really need some state examples of like how that could work. At the federal level, we're probably not the best people to conceptualize this, but hearing from, it'd be really powerful to hear in North Carolina, we have this type of pilot we've tried, or this is how we see this working in our state. Like those kind of examples really crystallize it and then give us the tools to recommend something more broadly.
I'm going to go through these last three real quickly because they're all important questions, and I'm hoping that we might be able to wrap them together a little bit and then open it up even for if anyone wants to come off mute. Angela asks if there's a guideline or checklist to start a program to support caregivers. And then Sue Deaton mentions that our Institute of Medicine in North Carolina, the Serious Illness Task Force report recommended forming a North Carolina task force that specifically addresses family caregiver needs. And what can we do collectively to support this action step? Which again, that's some of the work we're working on with you in the Changing the Care Conversation project. And then Jennifer asks, as community providers learn more about this information, is there a way to report the ways that they are contributing so we can see how far along we are? This may help other communities get ideas about what they can do as well. So as a starting point, guideline or checklist to start a program to support family caregivers. Do you know?
I don't. Off the top of my head, I can't think of like a official guideline. Did you think?
I just thought of something as you started saying that. I was thinking, I think Angela, I'll put something in the chat. I think there's I think NAC with their advocacy collaborative has a couple reports on creating, but that may be more on creating coalitions. I'll check that out and see if we can find anything. But that's a really good question, actually.
Yeah, I know what you're referring to, the NAC resource, and I think that would be a good starting point of like, how do you pull together any sort of coalition? That's what I was going to say, honestly, was like using the tools of community organizing, I think apply here and hasn't been done before, honestly. In like a formal capacity, like we know communities organize themselves, and we probably just haven't done a very good job of listening. But also, I think kind of the principles of, and Karen, Heather, and I are in this process right now, figuring out how do we build a coalition of caregivers, like how do we organize? So stay tuned as we're kind of in the middle of that process. But Heather and Karen, I think you have a lot of insight on what does it really look like to recruit, family caregivers to do advocacy, or like, how do you make that ask of someone? Like, how do you build a coalition of folks that feel really empowered to advocate on policy? So I will point to y'all as being really well versed. And we're doing this in 9 other states. So we're kind of in this process in other states of figuring out what this looks like. So it's a very good question.
So then that sort of also feeds into what Sue had said about the task force. It's kind of that whole, I know we're learning from some of the other states that have already done it, and they may call themselves different things, whether it's coalition or task force. And I think that's where we're going to have to keep just plugging along at that and figuring out the best way to approach it in this state, given our circumstances. I think that, go ahead. No, go ahead.
Oh, I was just going to say there's other states that have kind of done the state task force that they refer to in the RAISE Act that I would point to. And I think the Michigan is one that comes to mind. Like, there's a caregiving task force, and there's a diversity of stakeholders on that task force. So there's definitely a lot of value in having a quote unquote official state one, which is not to say other task forces don't exist, but just having that authority, I think is helpful. So I definitely point to other states that have done that. California has done some good stuff with their state master plan on aging. I believe Wisconsin has one as well. So there's some states kind of across the spectrum who have started to operationalize that. So they probably have the best insights as to how does that come together.
And I think this is an interesting thought, is how can community providers, as they learn more about this information, report ways they are contributing so they can see how far along they are. Again, helping other communities get ideas about what they can do as well. And I think that goes back to just what we're talking about, is it has to start at the state level, local level, local level up, state level down, as far as coordinating a coalition. And I think that's a challenge that we have with our group. So I appreciate that question. I do want to open it up to anyone who might have a final question. If anyone wants to come off mute, we have a couple more minutes and then we can wrap it up. I'm going to mute for now.
I will say, based off that question about how to report our progress, I know that's something RAISE is thinking about and NASHB's thinking about, but the public comment opportunity would be a good place to raise what you're doing. Otherwise, they don't know what's going on at the federal level. They really rely on people to report what they're up to.
That's actually a really good point. And again, we encourage everybody. We will include the slides and the links on the Serious Illness Coalition website, but definitely consider going and doing a comment to the link that was provided, so that they can continue to capture this information. And Siena, I forgot to mention that there is going to be a new RAISE Family Caregiver Council that's being put together right now, correct? The other group has finished their term.
Yeah. Yeah. So the official, pardon my gestures. Yeah. The council that was tasked with the congressional mandate to do the report. Yeah, now they're pivoting to a council that will kind of oversee this implementation. So I don't know a lot of the details yet. It's still kind of coming together, but NASHB's really intimately involved with that. So that'll be a good space to watch, like watch the RAISE space, because a lot of times there'll be, there'll be public meetings where they'll be talking about all these exact issues. And I think one of their goals is to, like I said, to come up with some way of folks to report what they're doing and what they're contributing. So I don't have a solid answer yet, but I know they're developing all of that now.
Thank you so much, Siena. It's been great. And I think just to be able to lean into the importance of family caregivers and know that there's an opportunity swirling around at the federal level, and we can hope that some of this roadmap will drive appropriations and funding, not only at the national level, but that we can be effective in North Carolina to prioritize where we want to be and help drive funding some of these priorities. And so we just appreciate your expertise and partnership and your willingness to kind of help us out spur of the moment. We know you hadn't planned on this yesterday, but we are just so grateful for you to come and talk to us in North Carolina to help us think through some of these issues.
Well, y'all are really the advocates that make this run. We basically get to just report on all the amazing things happening at the local and state level. So it's just a privilege to be in this space with you all as we all navigate these very challenging questions together. And yeah, thanks for the opportunity. I'm going to put my email in here if anyone wants to send me a direct email with a question you have or anything along those lines. I can try my best to answer it. And yeah, please continue to watch this space where we'll still be in the thick of it, and we'll be right there with you in navigating all these questions.
I just want to mention also, for anyone who hasn't watched those videos, I still think that's one of the best ways. If you go back to the RAISE videos that were done before the original recommendations to Congress last year, they're some of the most powerful ways to listen to the issues that family caregivers are dealing with and what some of their solutions were that relate to policy or legislative issues or any sort of support issues. And I think that's a great place to start when you're thinking about what you might want to comment on, whether you're a professional or a family caregiver or both. I'm going to go back and do that before I send my comments in, but it helps to clarify a little bit what can and can't be done by government agencies. I know, this is a big issue and we know we can't solve all the problems. But again, we really appreciate your help and we appreciate all the work we're doing with you and all the work you're doing for so many different states to help raise this issue even more.